The scalpel hovered in midair, suspended by a sterile field of containment gel. 6 bright blue eyes blinked in unison as Instructor Folrex leaned in closer to the holo-display. Subject classified as Class 3 trauma, subdermal hematoma, potential muscular rupture, emergency surgical prep advised. Folrex's voice trembled slightly, not out of fear but reverence. It had taken 39 galactic rotations to get his students this far, and now they had a real patient. The patient groaned. I'm fine," came a distinctly human voice from the operating table, muffled by a rebreather mask that no one had actually turned on. "Seriously? I think I just cut my arm." Follett spun around, his elongated torso twisting as he gestured toward the observation panel. "Do not interrupt the preliminary triage. You are stable, but we must proceed according to protocol." "Yeah, but I'm telling you—" "Silence, Daniel." Folrex turned back to the holo-display. "You are interfering with your own life-saving procedure." Daniel Pritchard blinked at the ceiling. He was 32, a trauma nurse from Ohio, currently volunteering on the Joint Terran-Valkyrie Medical Exchange Program aboard the training vessel Corivex. He had come on board to teach basic human anatomy and emergency response. He had not signed up to be strapped to a table with his shirt cut off and a crowd of bright-eyed alien students preparing to perform exploratory surgery on what was, as far as he could tell, a shallow laceration. The injury had happened 2 hours earlier, during a demonstration on how to stabilize a dislocated shoulder. One of the students, Ensign Vexa, had panicked halfway through the maneuver and dropped Daniel directly onto a supply crate. A sharp edge had grazed his left bicep, leaving a clean slice about 2 inches long and maybe half a centimeter deep. There was blood, sure, but not much. He'd wrapped it in gauze and asked for a medikit. 20 minutes later, he was in a surgical prep bay, surrounded by aliens arguing over which limb to intubate. "Folrex, please, just let me sit up and I'll show you how to close it. It doesn't need surgery." A lavender-skinned student stepped forward, her 3 fingers trembling. "Instructor, the subject is experiencing confusion. He's trying to resist life-saving intervention. Should we sedate him?" "You will not touch him without sterile gloves," Folrex snapped. "And we do not sedate unless there is confirmed neurospasm. Proceed with the diagnostic probe." Den yelped as the virtuose adhesive sensors pulled his arm hairs. "Okay, that's it. I'm not letting you guys cut me open for a paper cut." He reached over, peeled off the nearest biometric patch, and swung his legs off the table. The students gasped in unison. "Subject is mobile," shouted Vexa. "He's rising against trauma pressure. Is that even physiologically viable?" "Daniel, remain prone." Folrex looked genuinely distressed now. "You are risking further muscle separation. Your vitals indicate localized stress." Daniel pointed to the wall where his backpack hung on a hook. "Someone give me that kit. Now." There was a moment of frozen silence before one of the smaller students, Jin, if he remembered correctly, scurried over and retrieved the pack. Daniel unzipped it, pulled out a small suture kit, and moved calmly to the mirror beside the sterilization sink. "Watch carefully," he said, not bothering to hide the frustration in his voice. "This is how you close a superficial wound." He washed his hands with the antiseptic gel, dried them on a sterile towel, and then unwrapped the gauze covering his arm. The wound had mostly stopped bleeding. He irrigated it with saline, then pinched the skin together and began stitching with neat, practiced movements. The students stared, wide-eyed. "You're sewing yourself?" whispered Vexa. "Yes," Daniel said through gritted teeth. "Because it's not a Class 3 trauma. It's a basic cut. You don't need to open someone's arm to fix a surface wound." Jin stepped closer, watching intently. "But the blood. You lost fluid. Doesn't your cardiovascular system destabilize?" "It wasn't that much blood, maybe a few milliliters. I've had nosebleeds worse than this." Folrex stepped forward, eyes narrowed. "You are suggesting that you, a non-surgeon, can perform your own wound closure without guidance? I am a trauma nurse. I do this all the time, on other people, usually. But this doesn't even make the top 50. He tied the last knot, snipped the thread, and applied a small bandage. Done. No exploratory surgery needed, no intubation, no organ mapping, just common sense and basic field medicine. The silence in the room was profound. You closed the dermal rupture, whispered Vexa. With a needle and string. From suture thread, Daniel corrected. But yeah, that's all it needed. Fulrich stepped back, folding two of his arms across his chest. This is unorthodox. It's basic first aid. You are bleeding internally, are you not? No, not even bruised, just a clean cut. Look. He flexed his arm gently. Range of motion is fine, no tendon damage. If there were, I'd feel it. A low chime sounded from the central console. Diagnostic scans completed, the display now showed a clean cross-section of Daniel's arm. No deep tissue damage, no vascular disruption. Fulrich stared at it. Why? Does the machine confirm your assessment? Because I'm not guessing. I know how to read my own body. You guys are brilliant, but you're making things way more complicated than they need to be. Vexa raised a tentative hand. But surgery is the gold standard for Class 3 trauma. Daniel turned to her, voice softer now. This wasn't Class 3. You misjudged the injury based on your own species biology. For a Valkyrie, maybe that much blood means something serious. For a human, not always. That's why it's important to understand context. The students murmured among themselves, glancing from Daniel to the scan and back again. Fulrich let out a long breath. You propose that we adjust our injury classification algorithms to account for species-specific resilience thresholds, and maybe learn some field techniques that don't involve cutting people open every time they sneeze, Daniel added. There was a pause. Then Fulrich nodded slowly. Very well, we will revise the triage protocols. You, Daniel Pritchard, will instruct the advanced trauma group tomorrow morning, and you will be prohibited from demonstrating procedures on yourself again. Daniel grinned. Deal. And you will submit to a full vital scan at the end of each day for the rest of your stay. That's fair. As the students filed out to update their notes and whisper in amazement, Daniel packed up his kit and sat down on the edge of the table. His arm throbbed a little, but it was manageable. He'd clean the stitches again before bed and keep them dry. Should be healed enough for the bandage to come off in about a week. Stitches out in 10 days, give or take. Vexa lingered at the door. Daniel? He looked up. You made it look like magic. He chuckled. Nah, just practice, and knowing when not to panic. She nodded thoughtfully, then disappeared into the corridor. Daniel leaned back and sighed. Aliens are going to give me a heart attack before I ever get off this ship. The med training bay had been rearranged overnight. No more surgical drapes, no hovering scalpels. The observation dome had been dimmed to cut down on the intimidating glare, and someone had wheeled in a collapsible table covered in various Terran medical supplies, most of which had been confiscated from Daniel's personal locker. Daniel arrived just after the second meal cycle, still groggy from a dream about being chased by sentient scalpels. He set his coffee bulb on the counter and pulled on a clean lab coat. It didn't fit, of course. Valkyrie torsos were longer than human ones, but he wore it anyway, mostly to set a tone. The room was already full. A dozen Valkyrie students lined the edges of the training space, eyes trained on him with the kind of focused anticipation usually reserved for high-stakes diplomatic hearings. All right, Daniel said, rolling up his sleeve slowly. Today we're going to talk about wound assessment, specifically how to tell the difference between something that needs intervention and something that doesn't. Instructor Fulrich stood in the corner, arms folded. He hadn't spoken since Daniel walked in, but his expression gave away very little. Daniel suspected he was still trying to decide if yesterday's events had been a triumph of education or a galactic embarrassment. He gestured to the table. Let's start with what you've got here. Someone tell me what this is. Jin, smallest of the group, pointed to a box with trembling enthusiasm. That is a Terran cannibalization kit? Daniel blinked. A what? For removing damaged tissue for consumption, said Jin. as a redundancy protocol. That's dental floss. A pause. Ugh. Daniel picked up the box. This is for cleaning between teeth. Not surgery, not food prep, just hygiene. Next, Vexa leaned forward. This item, she tapped a plastic-wrapped packet, is for internal bleeding control, correct? He unwrapped it and held up the gauze pad. This is for absorbing surface blood. You press it on a clean wound to stop bleeding. Nothing internal about it. You don't insert it anywhere. Please don't insert it anywhere. More blinking. One student near the back scribbled something furiously into it. Now, Daniel continued, setting the gauze aside and reaching for a bottle of saline. Let's review the steps for cleaning a wound. Who here knows what this is? Electrolysis arrow. Vexa again. For intravenous balance restoration during plasma loss. Close, Daniel said, twisting off the cap. But this is just sterile salt water. For rinsing wounds. Keeps bacteria out. Volrex finally spoke. You are suggesting that rinsing with water suffices for microbial defense? The water's sterile, yes. You don't need a full antimicrobial foam bath for a paper cut. Paper cut? Jin's voice was barely audible. Cut by? Paper? Yeah, it's a thing. Don't ask. He poured a small stream of saline over a synthetic practice arm and showed how to dab it dry with gauze. See? No lasers, no nanobots, just rinse and pat. The room was silent again. Then a hand slowly rose. Yes? A tallest student with green-tinted skin pointed to the wound simulator. But if the dermis is breached, shouldn't we perform a sealant injection to prevent epidermal collapse? Daniel shook his head, picking up a small adhesive strip. Not if the wound is shallow. You can use these steri-strips. Keeps the edges together while the body closes it naturally. But what if the body fails? It won't. Not for something like this. The body's really good at healing small stuff. He moved on to demonstrate the difference between adhesive bandages and compression wraps, careful to point out when each was appropriate. He avoided jargon, used examples, and even let them take turns practicing on synthetic skin panels. 2 hours passed, and Daniel noticed something strange. The students weren't just curious. They were astonished, as if what he was showing them went against everything they'd been taught, which, he realized, it probably did. All right, he said, clapping his hands. Time for a practical. I'll give you each a scenario and you'll tell me what you'd do. No preloaded protocols. Think like a field medic, not a lab technician. He tapped a button on the wall panel and a case file appeared on the projection screen. A simulated human arm, discolored and swollen. Perka. Patient fell, minor abrasion, some bruising, no visible fracture. What's the treatment? Vexa stepped forward. We isolate the limb, scan for subcutaneous fluid collection, perform a tissue biopsy, and prepare a containment sling. Daniel raised an eyebrow. Why biopsy? To rule out internal necrosis. He paused. From a bruise? It could be the beginning of systemic collapse. It's a bruise. It is purple, she said, as if that proved everything. Daniel took a breath. Bruising is normal. Blood vessels under the skin break, and the blood pools. No need to panic unless it's spreading fast or the pain severe. You ice it, elevate the limb, maybe rest for a day or two. Jin stepped forward. But the coloration, how can you differentiate between necrosis and benign hematoma? You wait and watch. If it fades, it's fine. If it gets worse, you reassess. Medicine isn't always immediate action. Sometimes you have to let the body do its job. Polrex made a sound like a low click. This concept, non-intervention as treatment, conflicts with Valkyrie doctrine. Well, Daniel said, maybe your doctrine assumes bodies are fragile. Human ones aren't. We bruise, we cut, we scrape. We don't shut down from a little damage. There was a ripple of murmurs, some doubtful, others intrigued. Let me show you something, Daniel said, rolling up the other sleeve. He pointed to a faint scar near his elbow. That? Dislocated it 20 years ago. no surgery, just a reduction and a sling, healed on its own. Reduction? Someone asked. You pop it back into place. A stunned silence. Then Vexa whispered, You reposition your own bones? If you have to, yeah. Better than letting it swell and trap nerves. Jin looked ill. Daniel laughed. Relax. You don't do it casually. But humans are built to take some punishment. That's the point. The rest of the session passed in a blur of demonstrations. Daniel showed how to use butterfly closures, when to apply pressure, and how to recognize signs of infection. By the end, the students were handling the tools with less hesitation, even asking if they could try mimicking the suture pattern he'd used the day before. When the last of them filed out, Fulrix lingered. You have altered their expectation. I hope so. They now question protocols that have been standardized for centuries. Daniel shrugged. Maybe they should. Fulrich's gaze lingered on the empty suture packet. This needle, it is not even curved. How can it follow tissue planes? You don't always need curves. Sometimes you just need control. He began packing up the training table, organizing the supplies back into his kit. I reviewed your personnel file, Fulrich said. You've served in war zones. Yeah. You've treated injuries with less than this? Much less. And your patients survived? Most of them. Fulrich was quiet for a long time. We never anticipated needing to understand human healing in such detail. Our alliance assumed we would be the ones offering aid. We don't mind learning from each other, Daniel said, but you've got to let go of the idea that we're about to fall apart every time we trip. Fulrich nodded once. Then, in a rare show of agreement, he extended a hand with all 3 fingers. Daniel took it. Tomorrow, Fulrich said, we begin a comparative resilience module. You will demonstrate controlled injury response. Daniel blinked. Wait, what kind of controlled injury? Simulated, of course. Oh, good. Fulrich turned to leave, then stopped. And you will not perform procedures on yourself again. Already heard that. As the door hissed shut behind him, Daniel sat down and rubbed his temples. His arms still itched where the stitches were healing, but he resisted the urge to scratch. He had a feeling that tomorrow's session would be even weirder. By the next training cycle, the medical bay had been rearranged again, not with surgical drapes or scanning pods this time, but with rows of padded mats and a central table holding boxes of Terran first aid supplies. The overhead lights had been dimmed to reduce glare, and someone had placed a potted plant in the corner, possibly under the impression that greenery would help lower cortisol levels in humans. Daniel wasn't sure if it was real or just another synthetic approximation, but he appreciated the effort. The Valkyrie students filed in silently, bodies held in the kind of stiff posture usually associated with diplomatic court hearings. No one spoke until everyone was seated, and even then it was only Jin who dared to raise a hand. Will the simulated injuries involve bleeding today? Daniel shook his head. No blood. We're doing joint dislocations and sprains, just mechanical injuries, nothing open. Several students exhaled sharply, as if they'd been holding it in since entering the room. We're starting simple, Daniel continued. You'll each be assigned a scenario to manage using the Terran field response model. You'll stabilize the injury without any surgical tools, diagnostic pods, or neural suppressors. Just your hands, your eyes, and a basic kit like you'd have if you were stranded somewhere without equipment. Vexa leaned forward, antennae twitching slightly. No suppression of pain receptors? Nope. Not even mild sedation? Not necessary for a sprain, unless there's a serious tear, and we're not simulating those today. But the discomfort is manageable, Daniel cut in. We're not trying to eliminate all sensation. We're trying to teach proper assessment and stabilization. If you treat every bump and twist like a full-body emergency, you'll waste time and resources. He pulled a training dummy from the wall rack and laid it on the mat. It was modeled roughly on human anatomy, though the skin tone was an odd beige and the proportions were slightly off. He didn't comment. This one has a simulated shoulder dislocation. Anterior displacement. You'll need to confirm the direction of the dislocation, assess for nerve compression, and reduce it manually. Jin raised another hand. Reduce it how? Daniel knelt beside the dummy. Watch carefully. He palpated the shoulder, demonstrating the hollow under the acromion and the tightness in the deltoid. First, confirm that the humeral head isn't fractured. You do that by checking for crepitus, any crunching or irregular resistance. If it's clean, you stabilize the forearm, gently externally rotate the arm, and slowly abduct until it relocates. He moved with slow, deliberate motions, guiding the fake limb through the steps. A faint click sounded as the dummy's joint reset into place. See? No force, just steady, controlled movement. You don't yank, you don't twist suddenly, and you definitely don't panic. The students leaned in, scribbling notes or recording with their ocular implants. One of them, a pale green trainee named Lurex, tilted their head. What if the limb resists? Then you stop and reassess. Forcing it can tear the capsule or damage nerves. You wait, you let the muscles relax, and you try again with less resistance. Sometimes you reposition the patient to relax the shoulder girdle. It's about patience. You don't immobilize it before reduction, only if there's suspicion of a fracture. Otherwise, you reduce first, then immobilize. There was a long pause as the students stared at the dummy's now restored joint. Vexa finally broke the silence. Your species tolerates this procedure without pharmacological intervention? Most of the time. It hurts, sure, but it's not unbearable. Especially if you stay calm. Adrenaline helps. Jin looked mildly horrified. So pain is part of the process? Pain is just information. You listen to it, but you don't let it control the situation. Daniel stood and gestured for the next student to approach. All right, your turn. The first few simulations were clumsy. One student tried to rotate the limb too quickly and had to reset the joint. Another second-guessed every step, pausing between movements until the dummy timed out and reset. Daniel corrected them gently, offering cues instead of commands, and by the sixth attempt the process was looking smoother. After an hour, the group shifted to ankle injuries. Daniel demonstrated how to determine whether a sprain was minor or if it needed a referral. He pointed out the difference between swelling from ligament strain versus swelling from a fracture and showed them how to wrap an ankle with an elastic bandage. You want tension but not constriction. It should support the joint without cutting off circulation. Check capillary refill in the toes and ask the patient if they feel tingling. Tear in toes indicate vascular integrity? Asked Lorex. Yep. If the toes go pale and stay pale, you've got a problem. It's a fast, easy check. By the time they reached the final scenario, a wrist fracture requiring a makeshift splint, Daniel noticed something unexpected. The students were starting to improvise. One used a rolled gauze pack to pad the wrist before splinting. Another cut a strip from a foam mat to better stabilize the joint. They were adapting. After the last simulation, the group gathered near the supply table, hesitant but clearly processing the day's lessons. Daniel rubbed his temple. Questions? Lurex stepped forward. Your methods rely heavily on subjective cues, pain tolerance, observation, manual manipulation. How do they maintain consistency? They don't. That's why training matters. You develop judgment, you learn patterns, you get hands-on experience. There's no shortcut. But your technology is great when you have it, but it breaks, or it's not available, or you're on a planet with a magnetic field that scrambles your scanner. You need to be able to function without it. Vexa folded her arms. So, your medical resilience comes not just from biology, but from procedural flexibility. Exactly. Forex, who had been observing silently, finally approached the group. You find improvisation admirable, but dangerous. Daniel shrugged. It can be. But so can rigid protocol. Balance is the key. There was a short silence before Forex addressed the students. You will catalog today's techniques as supplemental field procedures. They are not to replace standard care, but to be applied when conventional methods are unavailable. You are required to complete a written evaluation detailing the risks and benefits of manual reduction techniques with species-specific analysis. The students nodded, some already pulling out datapads. As they began to file out, Jin remained behind, eyeing the dummy's shoulder. Daniel? Yeah. If a human dislocates their shoulder more than once, does it become easier to fix? Fortunately, yeah. Ligaments get stretched, makes it more likely to happen again. Do you train for that? Not on purpose. Jin looked back at the dummy. It is unsettling. How fragile you seem, and yet how little it seems to matter. Daniel laughed under his breath. We're not fragile. We're just built to keep going even when we probably shouldn't. Satisfied, Jin nodded and exited quietly. Daniel packed up the supplies, rolling bandages and resetting the dummy's limbs. He glanced at the clock. He had maybe 15 minutes before the next team came in to clean the mats. Fulrex lingered near the door. You have altered more than their training, he said. Daniel looked up. Didn't mean to, just tried to show them what works. They are reevaluating their assumptions, not just about human medicine, about humans. Daniel tossed a used gauze into the waste bin. Well, maybe that's overdue. You have taught them that pain is not always an emergency, that damage is not the same as failure. We've had to learn that the hard way. Blacks nodded once. Then perhaps we will learn it the thoughtful way. As the instructor turned and left, Daniel finally sat on one of the mats, stretching his back with a wince. His arm twinged slightly from the healing stitches, but it was more annoying than painful. He popped open a protein bar from his pocket, leaned back against the wall, and stared at the potted plant. It wasn't real. It didn't matter. It was still trying.